What's going on, everyone? Welcome back to another video. In today's video, we're going to talk about improper slash poor form when it comes to squats, what is causing that poor form, and what we can do to correct it. Let's get into it.
Cerebral flow in my head I go. Try reach me now, but my cell line slow. I keep it low, it's like where I go. Try teach me how, but I said I know. People know me like you like hope, and I need to know premise when I show. I collect my dough, do my thing and go.
Okay, we'll start from the bottom up. So when you're doing a squat, an issue that you might experience or you might see in other people is that the heels are raising off of the ground. This is, of course, dangerous because you could fall forward. So if you're doing a barbell squat, you have weight on your back and you fall forward, that can be damaging to your neck, your head, and other parts of your body. So you want to be able to have that balance and mobility to keep your heels on the ground as you push through the earth. But what is causing this is ankle mobility issues. So when you think about dorsiflexion, that is your ability to drive your knees over your toes. It's that bend at the ankle joint. If you have limited mobility there, you're not going to be able to get down into a deep squat. So that is what's causing that issue. And there also could be some muscle tightness that's causing that as well. So in that example, specifically your calves could be overly tight, which is also causing the heels to rise up. Okay, so two things we can do about that is, of course, massaging out your calves, maybe doing some foam rolling, and then two, doing ankle mobility exercises. So one I like to do is called I just call it an ankle stretch, but you get down, and I'll put it on the screen, but you'll get down to this position and we're just going to drive your knee all the way over your toes, and we'll rock back and forth doing this a few reps. So really want to get our dorsiflexion a little better to be able to get into that squat while keeping the heels on the ground. Okay, moving up the chain, let's look at the knee. So another thing I'll see in a squat is the knees caving in. Okay, when you're doing a squat, again, you want your knees to be in a straight line. You want them to be stable to support this action of you going up and down, especially if you have weight. Because again, if you have a lot of weight, you're going to a squat, your knees are caving in. It's going to cause you to lose your balance. You're going to fall. You're going to overstrain your knees. That could cause fractures, tears, sprains, and other things going forward. And we don't want this. So we want to be able to keep your knees in alignment. Well, why aren't they in alignment? Several reasons. So this could, one, be the glutes. So when you're going down into a squat, if the glutes are activating, if they're strong enough, they're going to pull your muscle group to the left, keeping them straight. However, if they're not activating, it's going to cause your knees to flop inward. So that could be one thing. Another thing that could be weak in addition to the glutes is your abductors. So when you're sitting on that machine, you see people, they're spreading their knees apart on that machine. Most of the time you see women doing this, but men should be doing it as well. That is to strengthen the abductor. So that's the muscles on the outside of your hips. Okay, so if that's weak, if the glutes are weak, again, you have no strength to pull your leg outward, so they're naturally going to cave inward. Okay, and then going back to the feet, so think about your feet. Have you ever been standing and you notice that maybe you kind of stand with the outside of your feet up and the inside kind of rolled in? So if you have that kind of issue, and some people have the opposite, where when they stand, their feet are going this way. So we have kind of like overpronation is what we'll call it. So that could also be causing your knees to cave in if you don't have good foot structure and foot stability. Okay, so that's two things to look for if you're experiencing that issue. On the reverse side, instead of knees caving in, they could cave out. So sometimes I've seen people when they go down to a squat, it's like their legs are severely just going outward. So this will be the opposite. This will be because the adductors, the inside of the hips, are a little weaker and they're not activating. The abductors and glutes can be over activated and doing too much work. So we have a muscle imbalance there. So to fix that issue, we would need to strengthen our inner thigh muscles. Okay. And then the same thing I said earlier. So when I was talking about the feet, when your knees cave in, it could be your feet also caving in. If you are someone that tends to rock on the side of your feet, then that can cause, as you go down into a squat, for your knees to separate, over separate during a squat. Okay. So Again, and that can be dangerous because you could be overextending your hips as well, so that can cause hip strain, knee strain, and ankle strains over time if you're repeating that motion in that format. And then the last thing I'll mention when it comes to squats is overextension. Okay, that can put a lot of strain on the lower back. Okay, so if you're someone that already experiences lower back pain, it could be because whenever you're bending down to pick something or just walking in your everyday life, you could be hyperextending your lower back. So you kind of always have that arch in your back. That's putting a lot of strain on your lower back. So we don't want to see that when we're squatting. And again, especially when you have weight loaded, because you're putting even more stress on your lower back. What causes this? Well, this could be hip mobility. So that could be one thing that's causing this issue. So we need to work on our hip mobility. And then the second thing, it could just be anatomy as well. So when you think about your femur bone, that's the bone connected from your hip down to your kneecap. If you have a very long femur, you naturally have to, how do I explain this? It's kind of like you have to overextend a little bit to get that long bone to bend enough to get you into a squat, if that makes sense. So if you have a shorter femur bone, you can get into a squat just fine without having to hyper overextend. You can't do anything about your anatomy, but what you can do, however, is squat with your heels elevated. So get some plate, put them under your heels, and just squat like that, because that will give you the extra elevation you need to get down in a squat without having to bend over excessively. Okay, so again, that was not really necessarily your fault. The hip mobility can be worked on, but the length of your legs cannot be worked on. So depending on which category you fall in would depend on which one you need to work on, or if both. Okay, so those are just a few things that you can look out for when you're squatting. Make sure that you work on these things so that you don't have issues going forward in the long run. If you like this video, you know what to do. Give me that thumbs up. The knowledge we gain is powerful, but it's knowledge we share that makes a difference. So share this to someone that you know maybe having some issues in that area. I'll catch you in my next video. As always, don't forget to crush it.